Briefing on the coronavirus pandemic across our state. Let's listen in.
I am not Governor Eric Holcomb. I am Lieutenant Governor Suzanne Crouch, filling in for Governor Holcomb. The governor is right now in Kokomo with Vice President Pence touring the GM plant that is producing ventilators for our national supply, but he will be joining us later. We'll follow our normal agenda, and we will start with our Indiana State Department of Health Commissioner, Dr. Chris Box, for an update. Dr. Box.
Thank you, Lieutenant Governor. Hello, Hoosiers. Today we report 669 new cases of COVID-19 across the state of Indiana, which brings to the total 17,835 Hoosiers known to date with COVID-19. We also have had 44, unfortunately, additional deaths, bringing the total of deaths in the state of Indiana to 1,007 Hoosiers confirmed to have died from COVID-19. And I want you to take a minute just to let that settle in. We've hit that 1,000 point, which is more than heartbreaking here in our state. Another 107 deaths have been clinically diagnosed, which means that those individuals had symptoms, x-rays, and CAT scans that were consistent with COVID-19, and their physicians documented COVID-19 as a cause of death. I want to remind you that those deaths are not included in the number that I verbally report to you each day, but on our website are reported just below. Sadly, Indiana has also had its first death of a person under the age of 19 this week. We've seen a few deaths occur in young people nationally, but here in Indiana, nearly 91% of the individuals who have lost their lives for this disease or from this disease have been over the age of 60. Nearly 95,000 Hoosiers have now been tested for COVID-19, and we expect those numbers to increase significantly when the OptumServe testing sites that we announced earlier go live next week. We expect those sites to be operational next Wednesday, and we'll have more details on Monday for you for this. We also are working with our local health partners to identify areas of the greatest need across the state to locate additional 30 Optum sites, and we will share those details when they're finalized. Our ICU bed availability is just under 43%, which is down from the 48% we saw about 10 days ago, but still holding steady, and this is encouraging. The availability of ventilators has remained steady with a slight increase in just over 80%. I want to follow up on our announcement about the centralized contact tracing that we'll be implementing on May 11th. To be clear, Indiana has been doing contact tracing all along. Our local health departments across the state have led this effort and done an amazing job. This new centralized approach expands on that capacity, which is critical as we expect tens of thousands of new tests coming in every week. I've been overwhelmed by the outpouring from people who want to help with contact tracing. More than 700 people have already reached out saying that they're willing to take this on as an important task. We have another group from the healthcare reserve workforce who have also expressed an interest. This number changes by the hour, but Maximus plans to contract everyone by close of business tomorrow so that we can identify those initial 500 individual people who will be a part of this workforce, and we can get that training ramped up. This is what Hoosiers do. We help each other, and I couldn't be more grateful or more proud. Speaking of proud and grateful, I know Dr. Dan has something that he'd like to share today regarding our long-term care workers. Dan?
Thank you, Dr. Box. One of the unanticipated benefits of this pandemic has been the public recognition of our frontline workers. As a hospital worker myself, I think I can speak for all of those working in hospitals around the state when I say thank you to all of those who have given us a word of encouragement, for the acts of kindness, and all of the well wishes we've received publicly and from our neighbors. But I want to take a minute also to recognize another group of frontline workers, and this is those who work in our long-term care facilities. The nurses, certified nurse assistants, qualified medical assistants, and all who in these facilities care for our most vulnerable citizens. Like our emergency medicine and critical care workforce, these individuals show up every day to care for those with COVID-19. And they've had to do this, like us, wearing PPE, to deal with staff shortages, while worrying about their colleagues who have fallen ill and themselves having to be concerned for their own safety and health. They have had to do this in a very different environment from the one that they are used to working in. One that now does not have visitation, one without communal dining, without communal activities, and they themselves having, sometimes on a moment's notice, to move residents around so that they can keep those who have COVID separate from those who don't. They have not only had to provide medical care, but they've also had to be the source of social interaction for a lot of the residents in these facilities. Whether that's a kind word, holding a hand, or providing reassurance to those who are ill and afraid, they've been that source. For some, they've had to do this also while managing their own grief that comes when you lose residents that you've cared for years. These workers are an important part of our healthcare workforce, and they're needed now, and they will continue to be needed throughout this pandemic. So if you get a chance, thank the nurse, the CNA, the QMA, and all those working in our long-term care facilities across the state who continue to care for our fellow Hoosiers during this pandemic. They are worthy of our thanks. Thank you.
Thanks, Dan. And I just want to echo Dan's words. I've got to be honest, I have had multiple phone calls from distraught chief medical officers over long-term care facilities and distraught administrators who are seeing outbreaks in their long-term care or residential facility, and they are heartbroken by it. They care very deeply for those individuals. I always end up sharing bad news, so today I was speaking with Lieutenant Governor Crouch, and I told her that my mother-in-law got sick about 16 days ago. She's in a long-term care facility, and she tested positive for COVID-19. It has been a really hard walk. She's 90 years old, and so it's been heartbreaking and incredibly frightening and scaring for my family and for me as we've walked through this, not being able to see her. But she has had amazing care, and she is now 16 days out, testing negative for COVID-19 and having become infected. So I just shout out to all of those individuals that do this loving care every day for our loved ones, and thank you from the bottom of my heart. And now I get to move to something else that's very positive and exciting. I'm going to get to talk with Dr. VEGA, who's here with us today. Can you hear me, Dr. VEGA?
Yes, I can hear you.
Awesome. So glad to have you with us. So earlier I spoke about the fact that our medical schools and our nursing schools graduated their seniors, their last year of schooling in medicine and in nursing early, and Dr. VEGA was one of those new doctors. So congratulations, Dr. VEGA, and how does it feel wearing the title doctor appropriately?
It takes some getting used to.
I'm sure it does. I'm sure you had no concept that at this point in your medical career, all you were looking forward to was starting your residency, right? At the end of June, would that be about when you would be starting?
Correct, yeah, either mid to late June is when most residencies are starting.
Right, and I know a lot of new doctors at this point in time are studying for their boards, which you have coming up, I'm imagining also.
Yeah, so in medical school, we take 2 boards early on, and then usually within the first year of residency, we take a 3rd board exam.
Okay, so instead, what have you been doing? Talk to us about, I know you're spending some time in the emergency room as a volunteer.
Yeah, so I graduated early, about mid-April. Most of my other classmates are going to be graduating in mid-May. We'll have a formal Zoom celebration for that. So I am working right now at one of the local hospitals here in Indianapolis at the VA. And working in the emergency department, we have both COVID and non-COVID sections. And really wherever I'm needed, I'll be working with another doctor, another healthcare provider, and help, whether it's scribing or helping with simple cases that come in, just kind of helping to alleviate the burden in the emergency department.
Yeah, that's awesome. So actually kind of putting into the computer what you know that professional, that physician or advanced practice nurse that's seeing the patient is asking those questions, and then you're documenting it, but learning a tremendous amount as you're doing it, I'm sure.
Absolutely, and having gone through medical school and knowing the training behind, just information behind all the medical knowledge makes all that a lot easier versus being a scribe and not knowing any of those things beforehand.
I bet they can't believe their luck that they have an actual physician helping them to do that on a daily basis. Talk to us a little bit about what it's like to graduate as a new healthcare professional at a time when someone like myself, who's been in practice for over 30 years, has never experienced healthcare in this way.
It's a unique transition, and I think it's something that all happened very quickly. And when we were given the option to graduate early, for me, it was a no-brainer. I went into medicine because I wanted to help people, and specifically, I'll be starting a residency in emergency medicine. And really, any time I can go out of my way and help out, I try to kind of fulfill that opportunity, and this seemed like a great opportunity to kind of give back. And, you know, there's two sides of the spectrum. This is my last, I guess, summer before I start residency. I'll be working full-time as a physician, but it's also a time where our country and the state of Indiana really need physicians and healthcare providers more than ever. So I was very happy to step up to the plate and help out where needed.
That's absolutely awesome. And just for our viewers' knowledge, I mean, you have lots of oversight in the emergency room there, lots of support from other physicians, and I'm sure that they have been very helpful for you too.
Absolutely, yeah. All the staff that I work with, the nurses, the PAs, nurse practitioners, attending physicians have all been absolutely phenomenal in the VA. And I'm very lucky to be working in that system.
That's great. So I wanted to ask, your residency, have you already matched for that and know where you're going to be going? Are we going to be lucky enough to keep you here in Indiana?
So I did a match. All of us actually find out on the same day, on March 20th.
Okay.
And it's usually a very momentous occasion where we all find out and open up an envelope. Obviously, because of COVID, the celebrations are a little bit different this year. However, our medical school at ICU School of Medicine hosted a Zoom celebration for all of us.
Wonderful.
And that I'll be attending emergency medicine residency at the University of Miami and the Jackson Memorial Hospital.
That is going to be a high-powered residency. Congratulations and good luck with that. Before we finish, can you share, I know you ended up getting sick yourself with COVID-19, and I know that my viewers or the people that have watched Governor Holcomb and I, when we talked to people, they were most interested when we interviewed Dr. Yoletti about his walk through COVID-19. So can you just talk a little bit about that?
Absolutely. So I was kind of one of those unique cases because I was infected with the virus very early on before there were any sort of restrictions in terms of social distancing, self-quarantine, things like that. I was actually tested March 13th, so way before
early.
Very early. And it affected me for about 2 weeks. For me personally, it was the most sick I've ever been in my life. I mostly experienced constitutional symptoms, so fever, malaise, fatigue. Felt like a terrible flu that would just never go away. And I think the scariest part was just the longevity of the symptoms. So I was sick for about 2 weeks or so, and it took time to recover. Thankfully, I didn't have to go to the hospital and get any extra supportive treatment. I was able to stay at home, self-quarantine, and just get better with that supportive treatment. But yeah, I'm very glad that, you know, thankfully it's all in the past. It's been over a month since I've experienced these symptoms, and I've been healthy since.
Yeah, gives you a little more freedom as you work. You still don't want to get reinfected, obviously, if you can. We don't know exactly with regards to that, but gives you a little bit better freedom about it, and know that you're not going to take it home as an asymptomatic carrier to some of your family then, too.
Exactly. And yeah, we're still learning so much about this virus, so I still continue to take precautions, of course, especially at the hospital and coming back. And making sure I change my clothes, I wipe everything down before going into my apartment, things like that.
Great. Anything else, Dr. Vega, you want to share with us before you finish today?
Thank you very much for having me, and I know it was already addressed earlier, but I just wanted to, again, give a shout out and give a thanks to all the healthcare workers out there that are going out of their way and really putting their lives at a sacrifice. This is really a time where we need everyone to kind of pitch in. And for all those volunteers too, there's so many people that are making masks and do different things to kind of donate their time. So I really appreciate the effort. And I thank God that we're just all kind of working together throughout this pandemic.
It's fabulous. Thanks, Dr. Vega, and good luck in Miami.
Thank you very much. I appreciate Dr. Cox. Thank you for having me.
Thank you, Dr. Box, and our prayers are with your mother-in-law
Thank you.
as she works through her recovery.
Yeah, thank
So
you.
thank you. And we will now have an update from Fred Payne, the DWD Commissioner. Fred?
We continue to see our initial claims for unemployment insurance decline from our peak week back in March. Our week ending April 25th, 2020, we saw 57,397 initial claims filed. This is still more than double the peak week prior to March of this year. While we're seeing an increasing number of claims in this extreme environment, we're also seeing, or reducing claims, we're also seeing a record number of payments that we're making. We've made a total of 1.3 million unemployment insurance payments in the month of April. This includes federal payments as well. This equals or totals a dollar amount of $732 million, 230 of which is in state benefits. The other $502 million is the federal benefits package, including the $600 add-on. While we have increasing claims, we also have increasing call volumes since the pandemic started. We fielded over 1.1 million phone interactions in the month of April. Although we have high call volumes, we still see some other top concerns related to this call volume. That's our call wait time. We're constantly making adjustments and making changes to ensure that we are reducing the call wait time. The improvements are trending in the right direction. However, these trends are not being felt by the callers. We're working to improve this. Here are a few changes that we're making. First, we're making some technology changes that will allow for twice as many callbacks to occur. We're training additional contract staff to help with deeper questions and issues that our callers are facing. We're also continuing to add additional staff. While we continue to make adjustments to our call center to reduce the wait time, we also want to continue to empower our claimants for self-help reasons. This week, the top reasons for people calling in still fall into the general questions category. Those general questions include questions related to the CARES Act under the Pandemic Unemployment Compensation Program and the Pandemic Unemployment Assistance Program. Questions around what do I do if I'm laid off, or if I'm continued to be laid off? How much will I be eligible to receive in benefits? All of these questions can typically be answered with our self-help tools. These measures, self-help tools, the changes that we're making, could all have an impact on the wait time. Now I'll provide an update on the PUC, or PUA, the Pandemic Unemployment Assistance Program. As a reminder, this is a first-time program for individuals who were previously not covered under our regular unemployment insurance system. Those individuals who have limited work history, gig workers, self-employed individuals, and independent contractors. The benefits include the $600 weekly amount on top of any calculated benefit. We started accepting new applications last week on April 24th. We've had over 65,000 applicants to successfully file. When new systems come along, we also see an increase in questions related to that new system. The most frequently asked question in this new system has been, what does it mean when I'm informed that I have been denied regular unemployment insurance benefits? As a reminder, that's part of our process. Keep in mind that in order to qualify for PUA, an individual must not be eligible for regular unemployment insurance benefits. The system will provide you with any next steps after you receive that notice. As a reminder, payments are targeted for PUA to begin around March 8th. We have an increasing number of questions that have been centered around return to work. And what does this mean for my unemployment insurance benefits at the state or federal level? Generally speaking, our unemployment insurance system was built and designed around the concept of having an individual who is out of work due to no reason of their own and providing them some bridge until they receive some employment. This is the backdrop that will assess all claims, federal and state. Claimants who have been placed on a temporary layoff related to COVID-19 must return to work if called back to remain eligible for benefits. Not returning to work when there is available work could be considered a refusal to work and potentially disqualify claimants from receiving unemployment insurance benefits. So for a claimant, what happens to their unemployment insurance claim? If a person returns to work, they should not file for weekly requests for payments. This is considered a voucher. That claim will stay open, but in case there's a subsequent layoff, again, do not file a weekly request. You can pick that back up if there was a subsequent layoff. If the person is called back to work, but only working a reduced number of hours, they may continue to file for weekly requests for payments to possibly receive partial benefits. We've had a variety of questions that have been asked to us and different scenarios posed. I'll give you a couple of scenarios here today. Let's say a person feels unsafe because of the virus and doesn't return to work. Will they be considered ineligible for unemployment benefits? First, all of these claims will be investigated on a case-by-case basis. But keep in mind, all of them will be evaluated on the backdrop of, is a person unemployed due to no reason of their own? Now, generalized fear of the virus itself would likely result in benefits being denied as a work refusal. The next question that's come along and that we're seeing quite a bit of, what if a person feels that their employer hasn't made appropriate accommodations for the employees? Well, although the Department of Workforce Development does not regulate health and safety, we do consider those things when we're looking and determining a refusal to work claim. So we'll continue to have more public awareness around unemployment and specifically around the return to work. We have a Facebook Live event planned or scheduled for May 13th. We have other interactive webinars and interviews that we'll be having around the state. Again, our goal is to ensure that we're empowering claimants to use self-help, but to also provide them with all of the information they need to prevent them from having to call to get additional information. In addition to providing unemployment insurance benefits, as a reminder, the Department of Workforce Development is positioned to ensure that individuals are being connected to job services, job training as well. So we have a variety of virtual job fairs that we've scheduled. This week alone, we've had one in Bloomington already for the healthcare industry. We'll have another one on May 5th in Eastern Indiana. We'll have one on May 6th for General Motors in Kokomo, where they're manufacturing the ventilators where our governor and vice president are today. They'll be filling more than 1,000 full-time and part-time positions. And I did have an opportunity to check before I got here, and we have over 500 individuals registered for that virtual job fair. As a reminder, you can find any open job postings in Indiana under indianacareerconnect.com. I also want to remind you of our Rapid Recovery Plan. This is, again, an accelerated action plan to support Hoosiers in securing jobs, growing skills, and developing talent when we work our way out of this pandemic. This is a joint effort with the Governor's Workforce Cabinet and partners like Strata and others. Keep in mind that even though we're seeing a high number of claims filed in Indiana, hundreds of thousands of claims filed, we're also seeing hundreds of thousands of payments being made. But we know that we need to continue to improve our systems to make sure that we're paying people better and we're giving them a better experience and that we're paying them at a more rapid pace. We'll continue to work on our systems and we'll continue to make sure that we're paying every individual who's eligible under our unemployment insurance program. Thank you.
Thank you, Fred. Thank you. We'll now hear from General Lyles from the National Guard. General?
Thank you, ma'am. I'm Brigadier General Dale Isles, the Adjutant General for the Indiana National Guard. So good afternoon. While we were able to honor our frontline responders in the Fort Wayne area on Tuesday with an A-10 flyover, a decision was made late yesterday to reschedule the Indianapolis area event due to inclement weather. The flyover is now scheduled for Saturday, May the 2nd, and this is our state's continued opportunity to recognize the overwhelming dedication of our frontline responders and to thank them for their unwavering support as they work to reduce the COVID-19 virus. I would like to remind everyone that the flyover time is subject to the completion of the Wing's pre-planned training mission. We would recommend you be outside a few minutes before the scheduled flyover time and remain patient with the aircraft as they arrive to the precise time. We are pleased to announce we were able to add a few locations to the flyover as depicted on the slide. Flyovers are Saturday, May 2nd from 11:35 a.m. to 12:15 p.m. and if any changes to these times occur, they will be published on the National Guard website page. Thank you.
Thank you, General. And we will now hear from General Counsel Joe Herons for an update.
Good afternoon, Joe Herons, General Counsel here in the Governor's Office. I'm here today to provide numbers. It's Thursday, numbers on the enforcement of the Governor's stay-at-home order, the complaints that have come in, and we have a state enforcement team that looks into those complaints. These are aggregate numbers. They go back to the start of enforcement a number of weeks ago. But to date, the number of complaints that have been investigated, 1,264. The number of complaints that have been determined to be unfounded or without merit, 1,130. The number of verbal warnings that have been issued, 115. And the number of cease and desist letters that have been issued, there have been none. So that number is 0 at this point. And so those are the numbers on the enforcement efforts for the Governor's stay-at-home order since it was implemented back in early April. Thank you.
Thank you, Joe. I'd now like to provide some updates on the Lieutenant Governor agencies. The Office of Community and Rural Affairs last week announced 13 recipients receiving almost $2 million from the COVID-19 response program. And I'm pleased today to announce another 49 communities will be receiving $8.7 million. They will be able to provide a range of services, including testing and necessary supplies, increase health service capacity, provide grants and loans to businesses for job retention. We offer our congratulations to these small and rural communities, and we also will be providing additional updates in the coming weeks. Another agency is the Indiana Housing and Community Development Agency. If homeowners are struggling to make their mortgage payments, they need to talk to their lenders right now. You can also visit 877gethope.org or call 877-GET-HOPE, and you will be able to see if you qualify to receive mortgage payment assistance up to 6 months or $30,000. Please visit now. And since last week, we have had over 600 Hoosiers apply to receive assistance. Thousands have called or visited the website. But if you are also a renter and are struggling to make your payments, talk to your landlords right now. You can also go to 877gethope.org and access a resource guide that the housing agency has developed that will help you navigate those difficult conversations as you look to make your payments. Our housing agency has also allocated $400,000 for the COVID-19 Emergency Relief Program. They are providing to organizations in our 16 housing regions $25,000 grants to support individuals experiencing homelessness with COVID-19. You know, the stories and the updates that we get are encouraging, and they They illustrate that we as Hoosiers are in this together. And I think that the stories that Governor Holcomb and I like the most are the good news stories. And I particularly am uplifted by the good news stories dealing with individuals with intellectual and developmental disabilities. I chair the Intellectual and Developmental Disability Task Force, and I want to provide a thank you to our direct support professionals who are caring for people with disabilities, and the dedicated agencies that are providing care. They go above and beyond for their staff and those that they serve. To Knox County, Casey Ark, they're providing free child care for their staff, delivering free meals to the staff on a daily basis, giving them one less thing to worry about. So thank you, Casey Ark. Columbia City's Passages, they're placing signs at the homes of direct service providers to thank them for their service. And we thank you, Passages. People with disabilities are doing their part also. Darren works at Lilly Technology Center, and he's sanitizing the common areas to ensure that the lab technicians can work safely. So thank you, Darren. And I think a personal favorite story of mine regarding individuals with disabilities are the weekly Zoom dance parties. Any self-advocate across the state that wants to feel connected and enjoy time with their friends can join the Zoom party. And that's what this time is all about. It's about continuing to show that we care for one another, and together we can get through this. Hoosiers are stepping out all over the state. From Evansville to Fort Wayne, the stories are incredible. In greater Evansville areas, they've created a COVID-19 crisis response fund that has raised $4.7 million towards their $6 million goal. It will go to help provide relief to our most vulnerable Hoosiers. These are incredible examples of communities proving that we are all in this together. And truly, we are. And now, I believe that we have Governor Holcomb joining us virtually from Kokomo General Motors. Welcome, Governor. Thank you.
Well, that's quite a unique introduction. Thank you, partner. It's good to be with you all. I got a great good news story going on behind me as well. This facility, this building here about 17 days ago was empty, and they went from a stop to a sprint to where we find ourselves today. Gonna end up hiring over 1,000 people. They're doing 2 shifts, 300 a shift right now. But on May 6th, as I think was mentioned by Commissioner Payne, they'll have another job fair in this area to continue to scale up. What they're doing behind me, just real quick, we'll get right into the Q&A portion. They are testing for the last 48 hours before these vents go out and get shipped across the country to mostly those areas of need. Now, thankfully, we got some of the good stuff first here in the state of Indiana up into 17 different hospitals in northern Indiana. But the scale of which this thing came together, this whole partnership, our federal partnership with the Vice President, with the supply chain, Admiral Polachek, and all the crew that came with the Vice President today, snapping all these pieces together, and then to have General Motors and Ventec Life Systems go from seeing that partnership where they used to deal with big parts and now getting into these very small where you have to be 100% correct. It has to work every second of every day. This next new machine here next to me is going to replace 5 machines in an emergency room. And you can see just how portable these machines are, these ventilators are. And that's what it's about. It's about mobility, and when someone's on a vent, you got to get them back up and moving. And so it's not just about moving the ventilator itself, but it's moving the person and getting them back on track. And with that, I would love to jump in. I appreciate the dream team there. I'm looking forward to getting back here within, I hope, about an hour and a half with you all, but we'll just jump right into all the Q&A if we could now, Rachel.
Tom Davies, The Associated Press.
Hello, Tom.
You have to unmute your own microphone.
Hello, Governor.
Good afternoon.
With the goal of having 10,000 daily tests with OptumServe and their sites, how was that target determined, and are you relying on some expert guidance, or is that being based on the number of tests and supplies you believed you could acquire?
No, that number was basically set based on the fact that public health has, CDC has recommendations of how many tests you really need to be able to do today per 100,000 individuals. And so we actually calculated a number of needing about 6,600 a day. So obviously we want to test as many people who need to be tested, and we can test, but we felt like this would give us that good number that we needed.
Steve with KPC Media.
Afternoon, Steve.
Good afternoon. Glad to be with you today. A quickie three-part question for Dr. Box, if I can approach it that way. First, in talking about contact tracing yesterday, I wanted to just retread a little bit of ground, and we had talked earlier. It was your opinion that testing asymptomatic people wasn't necessarily an effective way to determine whether or not they actually have the virus, correct? That's why we're talking about quarantines instead of just if somebody in your workplace were to test positive, you just don't go and test everybody else and then say you're cleared to go back, correct?
No, the fact is, if somebody goes into quarantine because they've been in close contact with a case, so somebody's in isolation, we find out who their contacts are, we tell them because of the closeness of their contact and the length of time they need to go in quarantine. Just because I test them at the beginning of that quarantine on day 3 or 1 or 5 or whatever does not mean I can let them out of quarantine, because that doesn't mean that within 2 days, 24 hours, 36 hours, 96 hours that they're not positive. So it doesn't make a difference in the quarantine. We are testing asymptomatic people around the state, especially in our higher risk facilities like our long-term care facilities, our jails, our prisons. We are also testing asymptomatic contacts of some individuals, especially if they are in a critical job where they need to be back at work. We are doing that in some of our meat packing plants. The thing about testing asymptomatic people is that you really do need to make sure, and the CDC's kind of even taken a step back and said you really need to be doing nasopharyngeal testing on these individuals. So that was
part two to that. When we're talking quarantines, say if I were contacted, I was a close contact of somebody who was positive, I need to quarantine for 14 days. Indirectly, doesn't that also mean that other people in that close contact's household may need to go on quarantine for 14 days too? For example, if I'm on quarantine, would my wife and my 1-year-old necessarily need to stay home for 14 days too?
That's a really good question. You kind of start to get to where do you stop this? At what generation per se of contact would you do this? I would say this, if you're in the home with somebody that's isolated, you need to be separated from them and quarantining. If you're in a home with someone who's been quarantined, they need to separate themselves from you. If you worked in a long-term care facility, you were a healthcare provider, you were working with a very high-risk population, then I would say potentially, yes, that would be the case. But really, it would not necessarily be true unless that individual in quarantine developed some type of symptoms or we felt the need to test them and they were positive.
Dan Klein, Wish TV.
Afternoon, Dan.
Good afternoon. Thank you. Fred Payne was kind enough to give some more information related to unemployment. But I had a couple questions in addition. What accommodations are employers required to make rather than a generalized fear of the virus? What are the valid excuses that will be considered? And is having someone who is in a high-risk category living at that home with them considered a valid excuse? And I realize Mr. Payne may be answering the first two, but specifically for Governor Holcomb, what's your message to men and women who may face the choice of a paycheck or their own health when it comes to being considered voluntarily quit or continuing to work?
Those are I'm looking at the governor right now if you want to go ahead. Okay.
Please go ahead.
Okay.
I'll follow up.
Those are good questions. One of the things that the Department of Workforce Development does not do is we don't regulate workplaces and the policies and procedures that they have in place. However, as I mentioned earlier, what we will do is we will evaluate on a case-by-case basis every claim that comes in. And if a person makes a claim that the employer's place is unfit and it's unsafe under COVID conditions, we will consider that as a part of a refusal to work determination.
Yeah, and I would just follow up with the fact that, A, just as Fred said, you need to go to your employer and try to work these things through, make sure that they understand and realize where you're coming from. If you have a temperature, obviously, I don't think they're going to want you to be in the workplace, but this does underscore another very important point, and that is, like I said a couple days ago, when we went into COVID-19, this pandemic, we were rolling, rocking and rolling, as a matter of fact. And we had 90,000 high-paying, high-demand jobs that we needed to fill. And we are going to get through this. We are making progress. And when we get to the other side, there's going to be some new jobs. There's going to be the jobs that were there before, and there's going to be market forces are going to come to play. And we're going to need to start steering people into high-wage, high-demand jobs. And that's going to be what we're focused on as we get back on track. And we are, like I said, making progress every day, but you got to go to your employer and you got to say, here's why I can't work. And if we need to get involved as a state, we can look into that. But I'm telling you, the pent-up demand and getting the economy back on track is of paramount importance as well. And we know through the Indiana Economic Development Corporation, there are companies all over the country, all over the world, that are looking at places to invest. And so my message to Indiana is, we occupied the high ground going into this, and we seek to take it back coming out of this. We've got to do it safely. But that requires every single Hoosier that has the ability to work to do so. We need you. When we say we're in this together, the way we get our economy back, whether it's Main Street or out on the farm, the way we get our economy back is that we get back to work. And so we're going to do everything we can to help equip Hoosiers with the skills that they need to fill the jobs that are there tomorrow, next month, next year.
Ryan, WEHT.
Afternoon, Ryan.
You have to unmute your own microphone.
All right, I got it. All right. Y'all can hear me?
Yes.
Yes, I can. I keep waiting for Rachel to tell me to unmute my phone.
So this might be more for Dr. Box, but has there been one of the big discussions is someone who recovers from COVID-19 immune to reinfection? First off, is there any evidence that you've seen to support that claim? And if not, has there been any reinfection? Someone getting reinfected again?
There has been sporadic reports out of China about this question of people being reinfected, but nothing documented, no good study. I would say that we don't know about reinfection. If you look at other SARS viruses, the immunity seems to be very, very good, but this virus is a novel virus, and so I constantly point out the fact that there's a lot about it we don't know. So my concern is that even when we get antibody testing back, which is that part of your blood that's going to hopefully give you that immunity, it shows that you've had the infection, but we don't know if it shows that you have immunity for 8 weeks, 12 weeks, 6 months, a year, or for the rest of your life. Will it be something where we have to give a vaccine on a yearly basis for it? So the immunity testing, the antibody testing is very academically interesting right now, but it's a little bit difficult to tell people that we are confident that they can be brazen and go out there and not worry about being reinfected.
Abdul Hakim Shabazz, Indy Politics.
Afternoon, Abdul.
Good afternoon, Governor. A couple questions. One for Dr. Box, one for you. Dr. Box, what is our criteria for testing maybe some of this antibody sort of test kits that are out there, allowing them in Indiana? I know there are some that are kind of like nationwide companies, but if you tried to order you could order in Illinois, but you couldn't order in Indiana. So I was wondering, do we have any sort of criteria as to, some of these things we allow in Indiana versus what we don't allow? And while you're pondering that, Governor Holcomb, for you, there seems to be some back and forth on whether Simon Properties is going to be able to open up in Indianapolis and other parts of Indiana come Saturday. The mayor in Marion County, they had a news conference this morning saying under their criteria, no, but if the governor said they could open, they would. I know you got the big halftime show coming for us tomorrow, but a lot of folks are wondering. I talk to a lot of small business people, whether it's the Leon Taylors, Dickie Blaine's, downtown comics, saying, "Hey, is it okay for the big guys to open up, but us smaller retail vendors, we seem like almost like we're stuck on the sidelines."
You will not be stuck on the sidelines. I will say this: we've tried to be abundantly clear that we will update our order tomorrow at 2:30. That will include retailers, malls, you name it. I've said A to Z. And Simon Malls that you referenced, that specific example, they have said that they will comply with both local and state standards. And I take them at their word. They will. And so you'll just have to wait to hear from me. You've heard from the mayor, and I fully support Mayor Hogsett. I've said before, local jurisdictions can always be stricter than what we have said. This has been the case, not just once, in the state of Indiana. And we'll seek to 100% of the time work with those local officials, just like we'll continue to work with Mayor Hogsett and Simon Malls, or fill in the blank.
Elizabeth Binion.
Oh, there was one other answer I needed to give. I know he had a question. Sorry, Rachel. So there was a question about Quest Diagnostics, I think, and some of the self-tests that you can do. And we did look into this. There's no law in Indiana that prevents this type of direct access testing. I think that the problem here may be that you have to be able to go to a particular facility, and we don't have those facilities here in the state of Indiana. But there's nothing that prohibits that in public health law or in our law.
Thank you, Dr. Box.
Thanks.
Elizabeth Binion, PBS, Michiana.
Hello, Elizabeth. Good afternoon.
Good afternoon, Governor. An analysis from the tech firm Dataminer identified St. Joseph County, along with Monroe, Tippecanoe, and Vigo, as one of 22 counties that may be coronavirus hotspots and states poised to lift some restrictions. Mark Fox, the St. Joseph County Deputy Health Officer who appeared on this media briefing yesterday, has said that he hopes you don't lift the stay-at-home orders, or at least don't try to take away the power of health officials to control the spread of the disease in their own jurisdictions. I wonder if you could talk about how much flexibility there will be for local public officials and health officials. And then also, a viewer had a request for advice. He says that he's been waiting for 6 weeks for his unemployment checks to come, and is starting to feel a bit desperate, and wanted to know how you can help.
Well, I'm assuming Fred is making his way up to the podium, but let me answer the first question first. We'll continue to work with local officials, and Dr. Mark Fox is exactly right. We will not strip away any local authority that wants to go above and beyond the recommendations or the standards that we're setting for our whole state. That also doesn't mean that one size fits all from a state perspective as well. So we're looking at data real time, been poring over it all day today as well, in anticipation for that 2:30 decision that we'll have to make. And let me just say this as well. When we roll out our next steps, like I said, put Indiana back on track tomorrow at 2:30. We'll roll that out in stages. This will not be, sound like a skipping record here, I know, but this will not just be back to normal or back to business as we used to do it. This is going to be very methodical and data-driven. Fred, you want to take the second part about the 6-week delay or how someone is filling out that application?
Yes. So our average time is about 21 days. That's average. There are those claims that don't go through our system automatically, and we have to assign an adjudicator to actually work the claim or adjudicate the claim. So in terms of a specific claim, since I don't know the details, I can't tell exactly why the person's claim has not been paid just yet. One thing that I do know is that the claim, if he's eligible, will get paid eventually. However, the specific reasons could hinge upon whether or not there's information needed from an employer, or whether or not the form was filled out correctly, or whether or not there was deductible income. There are a variety of reasons why a claim could be held up a little beyond the 21 days. So specifically for that person, if they could call back in or if they can send an email, they can send one to me and we'll look into it.
Annie Johnston, WTHI.
Good afternoon.
Good afternoon, everyone. I have a follow-up on something I asked Dr. Weaver earlier this week. I know Dr. Box wasn't there, so I'll give a little bit of background again. For 10 days now, the state has reported one more COVID-19 death in Vigo County than Vigo County is reporting. Long story short, the county says they specifically are not counting the extra death in the COVID-19 death total because there was a different primary cause. Instead, they created a new separate category for positive patients who died from something else. So my questions today are just, why do there seem to be inconsistencies in how the state and county are handling this data? And then is there a reason to think that's happening widespread? And, how could that impact the numbers and what we're seeing?
I think that's an excellent question, and I know my team was looking specifically into this, but unfortunately I don't have the follow-up on that with me right now. What I can say to you is I don't think there are significant inconsistencies. I would believe that this is an inconsistency, but we typically are in very close contact when it comes to birth and death certificates with our local health departments all across the state, because it's a very important part of what we do in vital records. So if there is a disagreement between the two, I would have to look at that from a medical standpoint. But again, I would rely very heavily on the physicians and the healthcare workers that were taking care of this patient who would have documented what the cause of death was.
Whitney Downard, CNHI.
Good afternoon, Whitney.
Good afternoon, Governor. I was just curious for Commissioner Payne, kind of jumping off, I'm sure every reporter on this call has had reports of unemployment, malfunctions. Do we have any records of how many people are on a waiting list for their claims to get processed? How many people have been denied? And what do you need in order to reduce that backlog?
Sure. I'll take it in reverse. What do we need to do to reduce sort of the backlog? So what we've been doing is we've hired, and we are continuing to hire, what we call adjudicators. Those are the individuals who actually work the claims. And when the claims come into our system, about 85 to 90% of those we really handle what I consider on an automatic basis. Excuse me. When we designed our system years ago, we wanted it to be as automated as possible, and that allows more claims to get through quicker. So when claims don't get through the automated process, that indicates that an actual person has to go through and work the claim. So about usually anywhere from about 85% get through, and then there's an additional probably 15% that people would have to work. And that number fluctuates because on a weekly basis, we have our claims adjusters working those claims. So again, we're hiring more people to physically adjudicate the claims. Those aren't people who have to come in with no experience. We have to have experienced people to actually work those. We are working on a process to ensure that we can look at claims and to make sure we're getting payments out the door around the 4 or 5 week period. So we're still working on that, and as a matter of fact, I'm going to go into some meetings a little bit later on today to have those discussions.
Our final question is from Jody Kaufman.
Good afternoon.
Good afternoon, Governor. I have 2 questions. My first question I think is maybe more for Dr. Box, and that would be, there a difference in the numbers between the total number of new cases reported every day and the total number of cases listed on the state's website of 510 cases. Can you explain that discrepancy? And then my second question for the governor, I think more would be, will the moratorium on evictions be getting extended since Hoosiers are still struggling to make financial needs?
I'm sorry, I would have to look specifically at those numbers on the website to explain that, but I can certainly do that and have an answer for you tomorrow.
Thank you, Dr. Box, and thanks for the question. We will speak to this tomorrow at 2:30, and I'll just end with just making the point that this has been, I've always been, I'll confess, I've always been a proud Hoosier, but even today on the tour behind a mask, you could probably detect that I was smiling ear to ear. Never been prouder. Today, absolutely included in that. It's just been an inspirational day to see General Motors and see Ventec Life Systems come together and meet the needs of Americans. And to know that this has occurred over a 17-day period is just almost miraculous, but for the fact that it's Hoosiers that came running. And they are getting it done in Kokomo. Kokomo has always been a resilient, gritty, tough, forward-looking community that we've been proud of. But to see union and non-union folks come together, to see General Motors and see Ventec, to see an auto company and a medical device company come together and make this magic behind here that's going to save lives. We have a lot to be proud of right now. I know it's been an ominous time as this virus has roamed around our land and the ripple effect that it's had, and some to tragic ends at times. But we know that we are coming together like we've never done before from every corner of the state of Indiana, and we are slowing the spread. We are putting ourselves in a position to get the state of Indiana back on track and lead ourselves out of this darkness. Thank you for everyone that's been pitching in. We're going to need your help over the coming months as well.
Thank you for joining today's briefing.
All right, you've been listening to Governor Eric Holcomb and state officials once again giving us an update on the coronavirus pandemic across our state. The governor has yet to release details on lifting the stay-at-home order. He says that should happen tomorrow. This, as Mayor Hogsett has extended the stay-at-home order here in Marion County until May 15th. We'll have much more on today's press conference at 5 and 6. Mike and Anessa, meanwhile, back with you in a half an hour for All Indiana.
With concentrated power that works at liquid speed. You'll